Okay, so Dr. Meity Elvina is going to present us her work about alternative treatments for pain through Dhikr, Hijamah, and herbal medicine as integrative medicine. Please, Dr. Meity, you can start your presentation. Thank you. Hello? Can you switch on your
please unmute yourself.
audio? Can you switch on your audio? Please, Dr. Meity.
Yeah, thank you very much for the committee, International Conference in Traditional Medicine and Phytochemistry. Okay, today, good evening for everyone. I want to present my research about alternative treatment for pain through Dhikr, Hijamah, and herbal medicine as integrative medicines. Okay. You can read it?
Yes, yes, please.
Okay. Okay. Alternative treatment for pain through Dhikr, Hijamah, and herbal medicine as integrative medicine. Most people suffer pain at some stage of their lives. So, therefore, pain is the most common reason to seeking therapeutic alternative or conventional medicine. So, pain management, particularly in chronic pain due to post-operative, is systematically have been developed by various great recommendations that assist the healthcare practitioner and patient in making decisions about healthcare. In recent years, we have developed a better understanding of the pathomechanism that link inflammation and peripheral sensitizations. So, this approach is known as complementary and alternative medicine. Integrative medicine is defined as medicine that reaffirms the importance of the relationship between practitioner and patient, focus on the whole person, is informed by evidence, and make us all of appropriate therapeutic and lifestyle approach healthcare professionals and discipline to achieve optimal health and healing. So include mental, emotional, functional, spiritual, and social aspect, and treating as a whole bodily functions. And we talk about how in the brain, we know about a prefrontal cortex regulate the stress response by making things seem less scary. And hypothalamus wakes up the pituitary amygdala detecting things that are scary or dangerous in the environment. So, to better understand the pain, psychoneuroimmunological approach is used to explain the mechanism of acute pain, chronic pain, and the working mechanism of pain control, effort including Dhikr from the perspective of spiritual variable. We can see the illustration, study framework effect of Dhikr for pain. Dhikr meditation distract how comfort mind and spirit from thalamus limbic system in the brain, and then reaction of emotion, relaxed state, meditative state, and modulating pain perception. So we have to modulate pain perception, and then we can feel pain intensity lower and physiological response, decrease blood pressure, decrease heart rate, and decrease respiratory rate. So we can see the figure that the modulation of pain, the pain pathway, involve transduction, modulation, and perceptions. A is thought, B emotion, C sensation in your limbic system. So the Dhikr stroke affirmation tapping for meal management this is thought to be due to the serotonin performance. The aim was to compare the mean perceived pain reported by post-operative patients who were given tapping treatment. The instrument include the tapping affirmation guide, the ELISA kit for serotonin level, and questionnaire for short form for pain perception. So affirmation is a saying or listening to and following the utterance of prayer with a focused mind. So the belief and the hope to the Almighty God will grant his prayer like istighfar 7 times and from the Holy Quran, and then we order for up to 10 minutes. And tapping is performed by tapping the fingertip of another person's hand or tapping the tip of one own finger on acupuncture points in Suzanne Lee, Hegu, and Feishu. So through the Dhikr, affirmation transforms the functional connection between amygdala and prefrontal cortex. It includes the descending pain modulator pathway, and then will stimulate peripheral inflammation cell to secrete serotonin, and then stimulate the secretion of endorphin, which modulate the transmission of pain in the dorsal horn, spinal cord, and the perception of pain is not felt. So we can see the figure, pain descending pathway. This descending pathway from the sensory cortex, limbic cortex, thalamus, amygdala, midbrain, and spinal cord in dorsal horn. In the pain descending pathway, you can see the blue line. And affirmation tapping on stimulation, Feishu, Hegu, and Suzanne Lee, the acupoint will modulate peripheral inflammatory cells so as to reduce the secretion of interleukin-6 and glutamate. And there are no inhibition of serotonin and endorphin secretion, and therefore inhibition of pain transmission in secondary neuron. This is a secondary neuron, the afferent neuron from the sensory and the perceptions. So the pain perception of the treatment group was lower than the control group, which was accompanied by low level of interleukin-6, glutamate, and high level of serotonin compared to the control group. So the performance of brain in the pain process in the prefrontal cortex amygdala can be modulated with the performance of the mind through affirmation and tapping. Thereby increasing the performance of descendant pain inhibition pathway. And then the second approach is cupping, Hijamah. The clinical manifestation of cupping, activation of nociceptor through cupping can stimulate A and C fiber with the involvement of the spinothalamic cortical pain pathway. And you can see that the activity of touch, pressure, and vibration on the skin surface, less pain is felt. The theory, cupping therapy effect, pain reduction effect, through pain gate theory, immunomodulation effect, immune system theory, blood effect, blood detoxification theory, and anti-inflammation circulation effect, nitrate oxide theory is to modulate the pain management. And the third approach, we use herbal medicine for pain management. There have been studies explaining the evidence supporting the role of cytokine in pain manifestations. It discussed possible therapeutic approach for pain control using therapies that target cytokines, such as dissolved receptor, receptor antagonists, neutralizing antibodies, and well as herbal therapeutic approach and at inhibiting cytokine productions. So natural compound derived from plant and animal have been used for hundreds of even thousands of years to find effective pain relievers. So a new study report at the potential for polyherbal extract to reduce inflammation. The novelty polyherbal used in the study is M-Saeritine. The M-Saeritine polyherbal composition has been shown to be effective suppressing inflammatory transcription factor. M-Saeritine consists of soybean extract, coconut water extract, and brown rice extract. So, as we know, soybean contain many active compounds. One of the active compound is genistein. Genistein has a powerful antioxidant with good anti-inflammatory effect. M-Saeritine can decrease pro-inflammatory cytokines such as tumor necrosis factor alpha and interferon gamma, also transcription factor, natural factor kappa B. The increasing of dose is M-Saeritine show more effective than lower dose. So M-Saeritine is potential polyherbal plant used as inflammatory, anti-inflammatory agent, and further it can be studied for use as herbal medicine for pain relief. So the conclusion in my presentation that integrative medicine for management involve herbal medicine, Dhikr affirmation tapping, and Hijamah cupping is integrative include spirit, mind, and body to pain management and the chronic pain. Okay, thank you. My presentations.
Thank you, Dr. Meity. You finished quite in advance. Are there any questions about Dr. Meity's presentation? I have to thank you a lot for underlying some different approaches that we can use to control pain, and also it's very interesting that you remembered us also the efficacy of positive affirmations or prayer itself, and studied in a scientific context, as you explained. Thank you very much. So are there any questions? In case, Dr. Meity, if you see any questions coming later, you can answer them into the chat box. So I think we can go on with the next presentation.